Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to go over a simple 10 to 15 minute seated exercise routine that you can use either before or after knee replacement surgery. These are going to be some great exercises to focus on your range of motion of your knee early on, as well as building up a little bit of strength in the legs and around your knee, as well as just helping to get the muscles activated, get everything moving, and reduce your risk of developing a blood clot or any type of complications after surgery. Now, of course, these exercises are just going to be kind of the early on beginning stages type exercises. You really want to get a build up to doing weight bearing, multi-joint, multi-muscle, strengthening and range of motion and functional activities as soon as you possibly can. So let's go over these exercises here. So the first one, we'll start from the ankles and kind of move our way up. So pumping our ankles up and down, simple enough. So you can do it this way, where you're just keeping the heels down and going up and down with the toes. I usually like to do maybe 15 or 20 repetitions, and you can do both sides at the same time for this. And then I like to bend the knee and keep the toes on the ground and just lift the heels up and down. So a little bit of strengthening for your calf muscles as well. And this, of course, is not very difficult exercise, but especially early on after surgery, when you're a little less mobile, good to do ankle pumps to reduce the risk of developing any type of blood clot in the leg or any other issues. From there, we can move up and do what we call seated knee extension, or you may hear referred to as long arc quads or LAQs. And just sitting in the chair, have a little bit of your thigh off the edge, and you're just going to try to straighten that knee all the way up and then all the way back down. Nice and slow and controlled. This is really, in my opinion, an underrated exercise. It's a good exercise to really focus on that knee extension and that knee straightening early on after surgery. So when you come up, really focus and try to get that knee as straight as you possibly can. Don't just go kind of to here and come back down. Really be intentional and focused, and give a good squeeze of that quadricep muscle when you get up, and really extend the knee and then bring it down nice and slow. This is a great exercise, of course, for your knee extension and straightening range of motion early on after surgery, as well as starting to activate and contract that quadricep muscle and hopefully start to build up some strength back to where you're able to do some more dynamic, more functional exercises. So of course, it's always good to do both sides. So I usually like to do maybe 2 or 3 sets of 10, 12 repetitions on each side. Again, really focusing on going nice and slow and controlled. This is more about contracting and activating those muscles than trying to do it as quick as you possibly can like that. The next exercise is going to be more for your knee flexion or bending range of motion. So I'll turn the chair a little bit here. And this is best with a chair that you can go underneath it a little bit, so like doing it on a sofa might not be as beneficial. But I like to start, so we'll pretend my right leg is the surgical leg, and we'll start with that out in front of me, and you're just going to slide it on the ground, and then as you get back further, it's okay, that heel can lift up, trying to slide the foot underneath, focusing on getting that bending as much as we can, and then coming back out. Now there's a couple ways to do this exercise. You can do just kind of smooth back and forth repetitions, just trying to loosen things up, keep it moving. Or you can do these prolonged holds, so getting back as far as you possibly can and then holding it there for maybe 10 seconds, 20, 30 seconds if you possibly can, and then relaxing and easing off of it, shake it out a little bit, and then do it again. Again, so you can do the repetitions in and out, or you can do it back as far as you can, hold it for maybe 10 seconds, and then ease off of it. Working on that knee bending, that knee flexion range of motion after surgery. Next, we're going to move up to the hips a little bit. So we're going to work on your hip abductors or your gluteal muscles. And I like to use a TheraBand. You can still get some benefit without the TheraBand, but I just like to see that added resistance. So put the band either right above your knees or right below your knees, and keeping your feet pretty close together. You can have them touching or just a little bit apart. And we're going to slowly, again, bringing our knees apart and then back together nice and slow. Don't let the knees crash back together uncontrolled. Keep good control throughout the whole motion. That will help to keep those muscles activated and strengthen them. So again, for this one, I'll do maybe 10, 15 repetitions for 2 or 3 sets. Again, working on both sides for this one. Of course, there's many great exercises that are going to be standing or laying down or laying on your side that are going to work these muscles as well. And so this is just kind of an early on after surgery, first few days after surgery, to start to activate those muscles a little bit. Another option for hip abduction, so strengthening your glute muscles, bringing that hip and leg out to the side, I call these windshield wipers. So you're going to straighten the knee, so now you're focusing on that quadricep activation, that straight leg, and then you're going to do that windshield wiper out and then back in. I like to keep my hand on the hip sometimes just to keep a good level pelvis, keep me in a good position. Do maybe 10 repetitions, and then it's always good to work on both sides, in and out, in and out. And then we can also work on hip adduction, or squeezing and working on those inner thigh muscles, those groin muscles. So I have a rolled up towel, you can use a pillow, whatever you have available. And again, you're just squeezing those muscles and then relax a little bit. Squeeze, hold for 2 or 3 seconds, and relax. Again, relatively simple exercise, but good exercise starts to activate some of those muscles. Also going to activate a little bit of those core and trunk muscles as well. That can be really beneficial and helpful with more functional dynamic movements. And then the last one I always include is a little bit of a misnomer, because it doesn't mean that you're going to be seated when you do this exercise, but you're going to start in a seated position, and we're going to do sit to stands up and down. So if you can, try with your arms crossed, not using your arms. If you have to, if you have a chair with armrests, if you have to early on, you can use those armrests, or you can push up from the seat of the chair. But try getting up to that edge of the chair, keeping a nice upright, neutral spine, and just come up, and then sit down nice and slow and controlled. Again, this is one of those exercises that is going to start to build up to some more functional, more dynamic exercises, doing body weight squats, maybe doing some deadlifts, doing some exercises that are going to really focus on function and strength and good range of motion, and get you moving and getting you back and recovered after surgery. I hope you found these exercises insightful and helpful. I'd love to see if you have any other ones, or you have any thoughts about the ones I showed you in this video. As always, I ask that you please hit that subscribe button and turn on the notifications so you can catch all of our videos related to knee replacement surgery, rehab and recovery, frequently asked questions, and much, much more. As always, please be sure to hit that like button so it helps spread this video to other viewers, and I thank you very much for watching.